In this presentation, we will explain the maintenance treatment offered at Tokyo International Dental Clinic Roppongi. After watching this video, if you agree to the terms, please sign the consent form for maintenance treatment. If you have any questions, please feel free to contact us. This video explains the initial examination, the purpose of regular checkups, treatment time, and treatment costs. It also explains the differences between maintenance treatment covered by Japanese insurance and self-pay treatment. There are significant differences between the two, so we will first explain Japanese insurance-covered treatment. If you wish to receive insurance-covered treatment, there are several rules that must be followed. In insurance-covered treatment, we cannot immediately begin maintenance treatment for new patients. The first reason is that we have no idea whether the patient's current oral condition is good or poor. Dental treatment always begins with an examination and diagnosis, followed by treatment or maintenance based on the results. It is essential to determine whether there are any existing conditions before performing maintenance. Maintaining a poor condition is meaningless, right? Maintaining a good condition is what matters. In insurance-covered treatment, the checkup includes an oral examination and a full mouth X-ray. Gum examinations check for superficial bleeding, the presence of pockets, and bleeding from the pockets. X-rays include a panoramic X-ray of the entire mouth. But to ensure that small cavities are not missed, we also take bite wing X-rays. X-rays not only detect cavities, but also assess whether the nerves of the teeth are affected or if there are any diseases at the tips of the roots. If necessary, we may also take X-rays to assess the condition of the tooth roots. This comprehensive screening of the entire oral cavity is essential, and the results will determine the course of treatment. Even if there are no symptoms, large cavities may already be affecting the nerves. In such cases, treatment can be more complicated than expected. Gum diseases often do not cause pain, so the condition may have progressed without notice. During the examination, healthy gums do not bleed. However, if there is bleeding throughout the entire mouth, cleaning alone will not be effective. Especially if there is significant bleeding from the gum surface, this is likely due to inadequate brushing or overall oral hygiene, so improving daily habits and techniques is more important. If the periodontal pockets are 4 millimeters or deeper or there is significant bleeding, periodontal disease treatment is necessary rather than maintenance. If the pockets are 6 millimeters or deeper, it is diagnosed as severe periodontal disease with a high risk of tooth loss, and thorough periodontal treatment is necessary. Even in such cases, insurance-covered treatment is an appropriate system for treating periodontal disease. As you can see from the diagram of the insurance-covered treatment process, the initial cleaning performed under insurance is superficial and does not clean the deeper areas. In other words, it is similar to brushing. Periodontal disease treatment begins by improving brushing habits and eliminating superficial bleeding, followed by addressing bleeding from deeper pockets. It is known that pockets measuring 4 millimeters to 5 millimeters may take approximately 3 months to improve. Pockets deeper than 6 millimeters may require 6 months or more, or even periodontal surgery in some cases. As such, treatment methods vary depending on the condition of your mouth, making the initial examination crucial. You may have thought that cleaning is a one-time procedure, but depending on the condition of your mouth, treatment may be necessary. Once bleeding stops and deep pockets disappear, we will move on to maintenance. This is called supportive therapy in insurance-covered treatment because support is still needed. Periodontal disease is prone to recurrence, and Swedish studies have shown that visiting the dentist every 2 to 3 months for the first 2 years, followed by visits every few months depending on risk, is effective. Treatment time is 30 to 45 minutes. The cost is 3,000 to 4,000 yen. For subsequent regular checkups, an X-ray is taken approximately once every 1 to 2 years, depends on the situation. So far, I explained the maintenance schedule for insurance-covered treatment. If you are interested, please also watch the video about maintenance treatment at your own expense. Thank you very much for watching.